Oh, so Sam, thank you for agreeing to talk with me today. Let's start with, should we start at the beginning or should we start with where you're at now?
Oh, should we start at the beginning? Shall
Yes,
we?
yes.
Yeah,
What
get
made
chronological
you,
order.
where did your interest in psychology come from?
I just always found humans really, really interesting, and I'd find myself drawn to, going when I went to the library and I was supposed to be looking up books on geography or something. I would find myself kind of lurking around the psychology section, having a bit of a read. And then my sister did a psychology degree, and
Uh-huh.
I just found the stuff she was bringing home absolutely fascinating. And I thought, yeah, that's the one for me.
Cool. And what's she doing now?
She's now a teacher, a primary school teacher, which I think quite a lot
Okay.
of psychology graduates go into, yeah, which she loves and brings her psychology into it. And, it really is very psychologically minded because of her degree. And I think finds that really useful in her career.
Yes. Yeah, that's cool. So what sort of age were you when she was doing that and you were lurking
So
around
I
the
would have been
psychology books?
mid-teens, I
Mm.
suppose. And I just thought it was absolutely like what could be more interesting than the stuff she was talking about how does human memory work and how do people work in crowds and to thinking, so I can actually go to school and just learn about this stuff. I don't have to
Mm.
learn German verbs and sort of, all this stuff that wasn't very interesting. I think
Yeah.
simply, but if you're drawn to humans you're interested in humans. Psychology is such a great degree to do. And I think psychology can get a bit of a bad rap as a degree. Sometimes people think it isn't serious, but actually I love psychology graduates. I think you're really taught to be very critical, to really think about evidence and what evidence means and whether a bit of research that someone's done really says what they think it says. And do you believe that? And what does that really mean? So I think it makes you a really critical thinker. And I think you have to write loads of essays, you have to make your argument, you have to be really good at putting your point across, which is really useful for subsequent careers. But it also keeps you numerate as well. You learn about how to manage
Yeah.
data nowadays, not when I was at university, but nowadays you learn to do a bit of coding as well, which, I don't think I would hate people to be put off by me saying that. You really have your hand held and they really teach you how to do it, and it's much easier than it sounds.
Okay.
But you come out with a degree that means you're numerate, you're literate, you're really good at arguing your point, you're really good at being critical about evidence. What could be better, really? And it's fascinating.
Yeah. Sold. I'll do
Yeah, good.
it. And then what did you do as you were going through your degree? Were you kind of starting to think, because yeah,
Yeah,
spoiler, I know you became a clinical psychologist.
yeah.
Um,
But it
was that
wasn't the
there?
direct route,
No?
actually.
Okay.
No, so I was always really drawn to clinical psychology during my degree. I really wanted to use psychology. I couldn't, I was fascinated by my degree. I just loved all of it. I could not get enough of it. And I thought I have to carry on doing this. And so we had some lectures by clinical psychologists. And I thought, well, isn't that amazing? You get to use all of this stuff to help people. Isn't that great? Um, so I was always planning to go into that. But then I finished my degree and I had a massive wobble. I can't even remember what it was all about. I think I just got myself really stressed in my final year. I worked really, really hard. I was absolutely determined I was going to get a first, which is the sort of highest mark you can get in a degree. And back then they didn't give very many out, but I was absolutely determined I was going to get one.
Mhm.
So I worked myself into the ground and I did get the first. But I
Well
think
done.
there was a bit of me that I just burnt myself out and I just thought, I don't want to do it anymore. And I went home after my degree. I had been applying for assistant psychologist jobs and I was sort of not really getting anywhere. And it was too much when I was trying to revise. And so I didn't have a job to go to. And I went home and I just suddenly, this void opened up ahead of me. I was 21, 22, and my whole life just lay in front of me, sort of blank. And I
Mhm.
panicked. I really panicked and thought, oh my God, what am I going to do with my life? And I opened up the local newspaper because actual physical newspapers were local
I
newspapers were
remember them.
thing.
Yeah.
And
Jobs came out on a Thursday, I think.
yeah,
Um,
exactly. And it had an advert for the local university back home, and they were advertising these 1 year law conversion courses. And I suddenly had this revelation that yes, well, I shall be a lawyer. Yes, this is a marvelous idea. I should be a lawyer. So I picked up the phone, I rang the number, and within 20 minutes, I was on the course. So in 20 minutes, I'm seeing the adverts being on the course. I mean, I think my parents were out at out. Otherwise, possibly would have stepped in and gone, do you want to just think about that a little bit? But anyway, too late. So I'd signed up, and so off I went to do this 1 year law course at our local university. And from day one, was absolutely eminently apparent this was a huge mistake. I could not have been less interested. It was very dry. I mean, I actually think a law degree would be quite interesting, but trying to do it all in 8 months,
Okay.
it was just cram, 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 cram. It just, and I just,
Mm.
so at some point during that year, I kept going, so nothing else to do, and I paid. But at some point during that year, I thought, no, I really love psychology. I was supposed to be in the, in the library, supposed to be studying my law texts, and kept seeing the psychology ones and going, oh, that's where I really want to be. So at some point, I saw an advert stuck up on the wall in the university, in the jobs kind of board, of a PhD being advertised. And I thought, oh, I'd love to do a PhD in psychology. And this PhD was advertised, and it was in anxiety disorders. And I thought, well, that sounds really interesting. So I applied and got called for an interview, and I got it. So I stuck the law course out, got the law course, scraped to pass. And then the next year went off to do my PhD in cognitive processes, so thinking processes in anxiety disorders, and absolutely loved it, just absolutely loved it. Best 3 years of my life, wonderful. And at that some point going through that, it became apparent if I wanted to carry on doing this research, then and so a PhD, for anyone who's not familiar with that, is it's when you learn to be a researcher, basically. So you do 3 years of learning to be a researcher, and I really loved it. But I worked out that if I wanted to carry on doing that kind of research, I probably needed to get myself qualified as a clinical psychologist, which is another 3 years at university. So now it's going to be 9 years at university. My parents are tearing the hair
Wow.
out. Um, but I applied to go off and do this 3 year clinical psychology training, and was very lucky to get on to a course to do that. So I went off to do that, did 3 years of that. That was quite tough, quite emotionally tough. Um, I was quite young, quite naive, quite sheltered, I think, really. And suddenly I was being sat in clinics in front of people who just had awful things going on for them, really difficult lives. I was 25, 26. I had no idea how could I help people really. But got through it, and by the end felt I had some skills to help
Mm.
people a little bit. But it was really clear to me that my what I really loved was the research, and I liked the clinical work, but I loved the research. And every time I was in a clinical situation, questions would just come, questions, 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 questions. And so I figured I would probably go back into research mostly at the end of my clinical psychology training, and which I did. So at the end of my clinical psychology training, and we can come back and talk more about that if you like, although I think you've probably covered that in other videos. At the end of my clinical psychology training, I got a job as half-time as a clinical child psychologist in Manchester Children's Hospital, and half-time working at Manchester University as a lecturer and doing a bit of research. And so I did that for a couple of years. And
And sorry, just jumping in. So half the time working with children at the hospital,
yes,
half the time was that lecturing clinical psychology
it was lecturing
trainees? Or,
clinical psychology
yeah,
trainees, yeah,
yeah.
which was a bit odd because I'd just been a clinical psychology trainee, and now I was on the other side of the fence. I was a real poacher turned gamekeeper situation, which was a bit strange. Somebody lecturing all my friends and having to be terribly professional around them when previously been out, at parties with them and so on. But anyway, um, yes. So what I found myself doing in that child psychology, the clinical psychology post, was I was seeing lots of kids who were highly anxious. And at that time, so this was the late 90s, um, there wasn't really very much written about child anxiety. There was one, maybe two trials of treatments out there. And they were treatments for, using cognitive behavior therapy, which I sort of knew all about. So I was quite drawn to that. Um, but there wasn't very much written, so I was trying to find out, well, how do you do this? How do you treat a kid with anxiety? And there's some bits out there, but it was all a bit thin and not very detailed and not very good, a lot of it. And so I thought, well, I've learned all about how you treat anxiety disorders in adults, what my PhD was on. So maybe I'll just try some of that stuff with kids and see where we get to. And lo and behold, a lot of it adapted did seem to sort of hit the mark a little bit. It seemed to make sense to kids. It seemed to make sense to their parents. And so I thought, well, this is what my research needs to be on. There's this huge gap. We don't know much about anxious kids. We don't know how to treat them. We don't know what's going on for them. We don't understand why they're anxious. So I'll make that my career. So I did. So I started doing little experiments with kids, trying to understand what's going on in their minds when they're anxious. And they threw up some really interesting stuff. So I published that and that sort of got a bit of interest.
So,
Um,
so again, sorry, just jumping in. So getting them to talk to you about the sorts of things they would be worrying about and the
yeah,
sort of thought processes they would be having.
exactly. So I get kids to talk to me about that. And another thing I would do, I would take experiments that had been done with adults that had helped us to understand what's going on for anxious adults. I took those experiments and I did them with kids um, to see if the same processes, the same thinking processes, the same um, stuff that was going on for anxious
Mm,
adults was also going on for kids. And it was the same. We got the same results in those experiments with kids as you got with adults. So that made me think, well, that's good. That's good news. If we're not a completely different species here, and I suppose we
yeah,
shouldn't have been surprised really, but we didn't know. So we wanted to check this out. And so then I started to put together interventions for kids, and I sort of did a bit of CBT for kids. And by that point, other people were getting quite interested in child anxiety. A few trials of CBT were coming out for cognitive behavior therapy for treatment of anxiety in kids. And what it struck me that actually that there was a bit of a gap, which was younger kids. So you can do CBT with a 14-year-old, fine, works great.
yeah,
You can't do it with a 4-year-old. Or
yes.
not, not really.
A very, very modified version.
Yeah, so and people do, and people have got stuff, little bits that will work now. But what I found myself doing was working with their parents, and I got really, really interested in this younger age group, and I got really interested in parents because quite often I would get an anxious child referred to me for me to see, and they would come in the room and they'd be followed by a parent who was themselves quite anxious because, well, you now know that anxiety really runs in families. And that's not always the case. Like you can have a really anxious parent and their kids are not anxious at all. And the opposite, you can have a really anxious kid and their parents aren't anxious at all. So it's sometimes, sometimes it happens like that. But quite often there'll be anxious child and the parent's quite anxious. And I got really interested in this. And when you've got a really young kid, like you say, you can't do much direct therapy with them. So what I found myself doing was giving the parents tips on like when your kids are really anxious, like you're outside the school gates at 8:30 in the morning, they're clinging to your leg, what do you do? I'm not there. So what can I teach the parent to do in that situation? And that parents really liked that. Parents love being skilled. They love knowing what to do. They don't want someone else to therapy their kid. They want to know what to do. So I found myself doing more and more with parents.
Yeah. Well, I'm thinking if you're an anxious person, it's chickens and eggs, isn't it? Because then you've got an anxious child and you were already an anxious person, but then you've got all your worries, all the things that you already worry about. Then you're worrying about the fact that your child is
Yeah.
is anxious.
And you're
And
worrying about that
it's
more than your average parent because you know how horrible it is being anxious.
yes.
So it gets to be this bit horrible vicious cycle for families that's really difficult to get yourself out of without somebody there to kind of just help you pull you out of it a little bit, and to give you the tricks and the tips and the things to do in that situation. So I got really interested in parents. And eventually, what we did is we put together this little program, like a course for anxious parents. So, at the hospital we were in, we had loads of courses for parents. Like, if your kid had just been diagnosed with diabetes, come on the course for parents of kids with diabetes. Come along, we'll teach you what to do, all the stuff. And we're like, well, why don't we have a course for parents who've got an anxious kid? So we did every Tuesday, Tuesday afternoon, you've got an anxious kid, come along on our course, we'll teach you all the stuff. And you can go away and do it with your kids. 10 weeks, every Tuesday afternoon, come along. And we ran these little groups of parents, and they were great. They were really brilliant. They were great fun to do. Parents really liked them. It was a bit of support, realizing it's not just you, there's other parents struggling with the same things. Parents took away loads of tips. And it seemed to really work. So we then got some money from the Medical Research Council, who are sort of like the research wing of the NHS, and they give out money for researchers to do research and find out if things really work. So they gave us some money to do a randomized controlled trial, which is a way of testing out whether a treatment works. And we did this trial. So it wasn't very big. I think we had about 70 families where there was an anxious child. And half of them got one of our courses and half of them got nothing. And we followed the kids up to see how they did. And the kids did really well if their mum and dad came on our course or their carer came on our course. So that was really, really promising. And we wrote a manual up called Timid to Tiger, which now any clinician, any psychologist can now buy that book and use it and just run their own courses for anxious kids for their parents. So that was really good. But in doing that, we got lots of parents saying to us, "Oh, this is great. Why couldn't you taught us this 5 years ago? Because if we'd known the stuff 5 years ago, maybe we wouldn't even be here. We could have put this stuff in place before our kid got anxious." And we got to thinking, well, maybe we could do that. I mean, what's stopping us? Why not? So we got together with a charity called Anxiety UK, who are this big national charity that do loads of stuff to support anxious people. It's all run by anxious people who like so everyone really, really gets it. And they're just great. They're a wonderful, wonderful charity. And I'm a patron of them. And they said, well, maybe we can help you out here. So we can joint with Anxiety UK. We put together this little 1-day workshop for anxious parents. So it didn't matter if your kid was anxious or not. If you were a parent and you felt that you were an anxious person and you wanted to learn some tips to raise a confident kid, you come along on this 1-day workshop. We hit with all the stuff, and then you go away. And people really liked it. So then again, we got some money to do some research on this, and we did another trial, another randomized control trial, which where we got 100 families where the parent was really anxious. And half of them got our 1-day workshop where we hit them with all the stuff about raising confident kids, and half of them got nothing. And then we follow their kids up to see how they do. And we weren't really sure this would work. 1 day is not very much. It's not, you can't do much in a day. But it worked. We had about a 16% reduction in anxiety symptoms if your mum or dad came on our workshop, which were like, well, crikey, for 1 day, cost 100 quid per family. That's great. Well, this is worth having. Um,
Yeah.
yeah, so that's where we got to. But then we decided we wanted to make this available to more people. We wanted it so that you didn't have to come to a group and take a day off work or get childcare. And we didn't have to train loads of clinicians, which is really hard to do. So we made a digital version of our intervention where a mum or a dad can just download it onto their phone, work through it in their own time. Don't have to see anyone, don't have to take time off work, don't have to get a babysitter, can just do it all themselves. And then we did a trial of that, a theme coming through here. I hate doing randomized controlled trials. They're a nightmare. But somehow, every time I do one, I say to my husband, shoot me if I ever say I'm going to do another one. I've now done 3, but there will be no more.
And what is it about them that's such a nightmare?
They're really, really complicated. So there's just loads and loads and loads of paperwork that you have to do, and there's loads of things you have to get exactly right. So, for instance, so you have to get loads and loads of people to take part. You have to get them to fill in loads of questionnaires for you, but there'll be different questionnaires for different people, and you have to try and make sure everyone's got the right one. And you have to make sure that everyone's filled in the right form so it's legal what you're doing, and check that it's ethical and you're not being unfair to anybody and you're not harming anybody. And then you have to store all this data really carefully. And you have to separate, and what I mean by carefully is, so someone fills a load of questionnaires in for you and they signed a form to say they're happy to take part, and then they fill in loads of questionnaires. And then you have to split those forms. So the form that says they agree to take part, which has got their name on, goes in that filing cabinet. And then the actual questionnaires they filled in with all their private information goes in a different filing cabinet in a different room without their name on. But somehow you've got to be able to link that name in that cabinet to that data in that cabinet. So then you've got another piece of paper that says person 473 in that cabinet is this name in this cabinet. And then you've got to store that in another cabinet. And it's all very complicated. And then you've got to randomize people so that some of them get your new intervention and some of them get nothing. And you've got to do that really carefully to make sure it's really fair. And you don't accidentally end up with all the boys in the treatment group and all the girls in the control group, or you make sure you've got the same number of girls and boys in both, and the same number of mums and dads in both, and the same number of older kids and younger kids. It's just really complicated, and there's just loads of little detailed things to think about that if you get them wrong could mess up your results. So they're all really, and trying to get, the biggest difficulty is always trying to get people to take part because it's a big
Hmm.
demand on people. It's a big ask being taking part in a randomized controlled trial. It's a big commitment. So getting people to take part is hard, and then clinging on to them so you don't lose them part way. Because if you lose them part way and you don't find out how their kid's done, might as well not been there in the first place, as far as the research is concerned.
Yeah, yeah.
So
But
they're
for some of
enough.
them, of course, they'll, I don't know, they might have moved house, they might have got a new job, they've got other
Yeah,
things going on
all
in
of
their
these things,
life.
or something's
Or
gone
they're
on in
thinking,
their
well,
lives, they're just
I've
too
got what
busy
I've
now.
needed. I've got what I
Yeah,
needed. I don't want to fill this form
exactly.
in
Parents
again.
are really busy. Like, no shade on parents who end up dropping out of things. It's just, it's really hard. Um, yeah, but it just makes it really challenging to run a randomized control trial. You need a big team, lots of helpers, everybody
Yeah,
doing the same thing, everybody knowing what's going on. Yeah, it's challenging.
yeah. And presumably before all of that, there will have been the getting the funding agreed.
Yeah, yes.
Um,
Yeah, it's quite hard to persuade funders to give you money because these things cost a lot of money. So, £500,000, £1 million. So persuading someone to give you that amount of money, you've really got to show that you're going to do it right, and you know what you're doing, and they can be very, very picky.
yeah. I mean, and what I notice as you're telling the story is it all feels so logical. We did this, and then we did this one, and then we did that one.
Yeah.
Um, and often it looks like that, doesn't it, when we look back
Yeah.
at it?
Yeah, it looks like there was a nice clean thread running through it all.
But
But
it's making me
actually,
wonder, were there directions that you wanted to go in that just couldn't happen, that
yeah.
you couldn't get funding for?
Yes.
Or
Yeah, yeah,
yeah,
definitely. Yeah, it does feel like there's a nice clean thread and a nice clean story, but actually there are lots of dead ends along the way. So one thing particularly we just wanted to do a couple of years ago, we got this idea, and I'm really gutted about this that we didn't get this. We wanted to do what we were doing with anxious parents, with parents who had eating disorders, because we know that eating disorders can run in families. They don't always, but they can run in families. And I had a PhD student who was really interested in this. So she did a little bit of research, just kind of digging around to find what had been done, and talking to lots of parents who had eating disorders. And she found that very little had been done. There's no support given to parents with eating disorders, and parents with eating disorders are desperate for this. Every parent she talked to was like, "Tell me what to do. Do we just tell me what to do?" Like, so I'm sat at the dinner table, my kid's being fussy, they're not eating enough, they're eating too. What do I tell me what to do? I need to know what to do. And my poor PhD student's like, "I don't know." But it
yeah,
made it really clear to us that something needs to be done here. So we got together with a team in Birmingham at Aston University, who are kind of the world's leading experts in feeding. How do you feed your kid? How does any parent feed that? Doesn't you don't like parents, whether you've got an eating disorder or not, if you're just a regular parent, how do you feed your kid to make sure that they come out with healthy attitudes to food, healthy attitudes to body image, and they eat a range of reasonably healthy foods without being really neurotic about it? It's actually really hard.
yeah, yeah,
And so this team in Birmingham, they're the world's leading experts on it. They know exactly what parents need to be doing. So we got together with them. They were going to bring that expertise. We had an expert in eating disorders on the team. We had us who are experts in sort of parents and how to work with parents to sort of promote well-being in your kids. And we didn't get the funding. We put in this application. It took months and months of work, and they liked it. You go to a stage one of funding, and they said, "Yeah, we like it. Give us more details." We put another months and months and months of work in, and then it goes to stage two, and then they're like, "Oh no, sorry, no money for you," and that's it. And 12 months of really hard work, and it's gone nowhere. We may pick it up again. One of the team members, the PhD student who was the original PhD student on this, is now finished her PhD and is sort of working in the field, and she might pick it up and go and make it happen, hopefully, because it feels really valuable and really important. People really want it. Parents
Yeah.
really want it. But
And
yeah, it
well,
doesn't
like you, yeah,
easy.
I mean, that feels like a natural sort of next step, doesn't it? Because it's anxiety again. It's anxiety about my child's eating and
It's a
attitudes
really
towards
good
eating
point.
and
I hadn't thought
body.
about that, but it is. It's the
Um,
same. Yeah, it's the same root
but
stuff.
and I guess where it sounds like a lot of what you've done has been, it's been general anxiety, hasn't it? It's
Yeah.
not been around,
Yeah.
kids with spider phobias or
No, it's been
kids
whatever
with
type of anxiety. Yeah.
um, emotionally based school avoidance. It's been really general, but here you've got a
Totally.
very specific
Yeah.
um,
Yeah.
focus of the
Focus to the
anxiety,
anxiety.
haven't
Yeah.
you?
Yeah.
And as you were talking about that, my brain was almost doing a little run through with some of the other sort of common mental health challenges and thinking, would you then be looking at parents who struggle with depression or parents that have
Yes.
experienced trauma?
Yes.
Um,
Yeah,
but
we are definitely the depression one is on our list. Whether it will happen or not, I don't know. We just got some funding, or my colleague Abby Dunn led on this. I'm sort of peripherally involved. She just got two large grants to work with parents who are in inpatient psychiatric settings. So parents who've been taken into hospital because their mental health has got so bad and they're struggling so badly, they've been taken into hospital, which means they've been taken away from their kids, which is really tough for any parent. Like if you go into hospital just to have your appendix out when you're a parent, it's really tough. I had to have some surgery when my little girl was a baby. It was awful. It was awful being separated from her, even just for a day or two. If you are separated for weeks, months, and your mental health is really poor, crikey, what is that like? And what impact does that have on your child? What impact does it have on your mental health? Like you're in hospital trying to get your mental health better, but someone has done the worst thing you can do to a parent, which is take your child away. So how does that
yeah,
work? So we did a bit of research where we went into inpatient hospitals to try and find out what is it like? What is it like if you're an inpatient and you're a parent? What support do you get around being a parent? Do people support you to see your kids, to make sure when you see your kids, that's really positive and really lovely and really supportive? Do you get support in rebuilding the relationship with your child if you've been in hospital for ages? And the answer we found to all of these questions was nothing,
yeah,
nothing. Half the time, people didn't even know their inpatients were parents. And that just seems really poor. And I
yeah.
know there's huge pressure on psychiatric services, and they are really struggling to do the very best they can in a very difficult environment with no money. Um, but this feels like it's kind of important. So Abby just got two big research grants to really look at that and see what we can do. Can we make some interventions to help parents when they're in patients? Can we've got part of it is training ward staff to even just ask, have you got kids?
Mhm.
And make sure notes are made on that, and to encourage people to just stick a picture up on their walls and make sure that visits are happening. And if a visit happens, if your kid comes in to see you, that's not in the broom cupboard with people coming in and out, just
Mhm. Well,
basic.
I'm thinking, having worked in inpatient wards, how chaotic and sometimes I'm thinking from a child's
Frightening.
perspective, quite frightening
Yeah.
place where you're seeing people, in really high levels of distress, sometimes not necessarily the parent, but perhaps some of the
Other
other
people in the
other
wards.
inpatients.
Yeah.
And, it's having a place that feels safe for the child to
It
come
feels
to.
safe.
And like you
Yeah.
say, it's the follow-on support, isn't it? It's the rebuilding the relationship. And
Yeah.
depending on the age of the child,
Yeah.
there might be some confusion and some anger, and you left me, now you're going to leave me again, and am I still safe with you?
Yes.
And depending on the nature of the illness, what the child might have seen,
Yeah.
because sometimes
Absolutely.
people are
All of
doing
these
some
things.
very disturbed, very,
Very,
again,
very
frightening
upsetting
for the child to
behavior.
see behavior.
With no
um
support around that for the child to explain that to that
mm,
child in child-friendly words, what was going on there and how it's okay. It's not about you and you've not done anything wrong. And all of this,
yes,
so like some really, really basic stuff could be done quite easily. So these two
yeah,
research grants we've got now are very much looking at that. So one of the research grants, we've got a psychologist who specializes in architecture and how architecture affects our well-being. And this project is based around if you are going to have a family room in a psychiatric hospital where kids come in to see their mum and dad, how do you build that room and how do you design that room to make sure that none of this stuff is happening? So it's a little bit away from the ward, so you're not seeing frightening stuff, so that it feels nice. So there's some toys in there because, like, you go and see your mom or your dad, and most of these rooms have got like some wipeable chairs, and that's it. And like that's not how families don't sit in chairs looking at each other with no. You'd play with some toys. There'd be a sofa, maybe even a telly. I mean, so we're doing this research, talking to kids, talking to parents who've been in hospital, saying what do you want, what would work. And that's been really, really, really
Yeah.
interesting stories we're hearing. Some of them are horrible. Like, one kid saying they went in and they just remember there being blood on the wall. Like, that's not acceptable.
No.
I mean, anyway, so yes, lots of work to be done.
As an aside, do you know the work that Scamp and Dude are
No,
doing?
I don't. The clothes shop.
So, yes, the clothes shop.
What
I
on
was at a
earth's going?
conference last year,
Yeah,
and the founder of Scamp and Dude,
yeah.
the origin story of Scamp and Dude is that she had to have brain surgery
Uh-huh.
when one or both of her children were very small,
Yeah.
and she had to be away from them. And because it was brain surgery, and she had to have head shaved and I don't
Yeah.
know, staples
Look,
or,
yeah, look really different.
had
Yeah.
to look really different. Her and her partner decided that the children wouldn't come and visit her in hospital because seeing her like that would
Be
be,
upsetting.
they felt like that would be more upsetting for the kids than to see her. So there was, yeah, I can't remember the length of time, but there
Yeah.
was a relatively significant length of time that she could be
Yes.
away.
Yeah.
She came through this brain surgery, and I don't think it's exaggerating to say, she wasn't sure if she would come through
Oh my
it.
goodness. Yeah.
And then she decided that, right, my life's mission now is I need to do something more with my life. I need to give back.
Yeah.
And one of the first Scamp and Dude products was, I think they call it a superhero buddy.
Uh-huh.
And because she was thinking about what could have helped my kids during that time. And they made these superhero buddies. You'll see them if you go in the shop or on the website. And it's a superhero buddy. It has a lightning bolt. So when you press it, you get this lightning power. And I think there's a pocket that you can put a photo of the parent
Oh,
in. So these are
oh
now,
my
it makes me
goodness.
emotional talking about it, but these are now freely available, I understand,
Wow.
for kids where parents have to be in hospital.
Oh, I'm
So,
going to go and look straight into that.
yes,
That is brilliant. I wonder if it might even be worth us trying to get in touch. Anyway, that's
yeah,
brilliant. Thank you for
yeah,
that.
that's
Yeah.
why I'm mentioning it, because there might be some sort of collaboration opportunity.
Yeah.
Um, they also do things. They have scarves for women going through breast cancer
I've seen the
treatment.
scarves. I've seen the scarves in the shop. Yeah.
Yes,
Brilliant. Yeah, they're obviously got a real social mission. That's
yeah,
brilliant. Yeah.
yes. Pants now for men going through testicular
Oh,
cancer
okay.
treatment.
Oh,
Um,
yeah.
and yeah, and her, I mean, she was so great to hear talk at this conference,
Yeah.
because she was talking about the numbers of women being diagnosed with breast cancer, the number of scarves given, and it's a very big number of scarves they've been able to donate. But she's looking at it going, well, it's not all of the women being diagnosed. Like,
No.
we've got work to do. But yeah, really inspiring, really impressive.
Yeah, great.
I'm aware of time. I feel like I could talk to you all day.
Likewise.
I want to know what your tips would be for students thinking that psychology might be the thing for them.
Okay. Thinking psychology or clinical psychology or both or
Let's go psychology. Yeah, let's keep it
both.
broad, because of course
Yeah.
you've got that insight into clinical world and research world.
Yeah, 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 yeah. So if you want to be a psychologist of some sort, either a research psychologist or a clinical psychologist, then you need to get a psychology degree. Almost all universities do psychology, so you've got tons and tons of choice. Normally, it would be 3 years. They're all quite similar psychology degrees because there's something called the British Psychological Society, which oversees psychology degrees and makes sure that they all cover the right things. In fact, almost all of them. I think there's a few psychology degrees that aren't underneath the British Psychological Society, and you might want to just check that out. Check that the degree you go for is covered by the British Psychological Society, but they almost all are. And they make sure that you cover all the important basics. So all degrees are quite similar. You'll cover a bit of developmental, child psychology, and you'll cover social psychology and cognitive psychology, which is about thinking, and What else? God, it was a long time ago I did my degree. What else? You can
Statistics. It's always can't say it.
abnormal.
Statistics and research.
Yeah, statistics and research, clinical psychology, um, loads of stuff. And then so you do all the basics. There'll be like 6 or 8 modules that you'll have to take that cover the basics. And then you'll have usually in your second and third year, you get a bit of choice of things that are more in, that your particular interests. And they will vary from university to university. In terms of getting onto a psychology degree, there aren't, I don't think, any specific things that you need to do. Like you don't need work experience to get into a psychology degree. Um, and some universities, if you're aiming really high, if you want to go to the really fancy universities that are asking the highest grades, they might like to see that you've done something that's a little bit psychology-ish. But that could honestly be just reading a book. It could be watching these videos. I think that would be really great super curricular for kids to do and then put it on their university application forms, say you'd watch these videos. Um, I think there's maybe some essay competitions if we're doing in sixth form, which you can take part in, which are about psychology, but I don't know the details. But
Me either.
you definitely don't need to be getting work experience. If you can say you've read a book and you've watched some videos or you watch some other things on YouTube that are about psychologists, that's plenty.
And that's useful just for yourself, isn't it? Not just to get you
Yeah.
onto the
To
course,
know
but
if
also to
you
make sure it's the right course
to
for
make
you.
sure it really is something you're really
Um,
interested in. If you read a book on psychology and think, oh God, this is unbearable, maybe try another book in case you picked the wrong one. But if you read a couple and just think, I can't, then don't do a degree in it because there'll be lots more of the same. Yeah.
yes. I always joke with my kids that I did psychology A level. That was where it started for
So
me.
yeah,
And I would, had this really big, thick textbook. Um,
gross.
yes, yes. And I would read some of the chapters that weren't covered in our syllabus because I was
Me
interested.
too.
And I
Read it
remember
cover to
saying to
cover.
my children, I had never read bits of any textbook
Yeah.
before that I
That
didn't
was
need
not happening
to.
in chemistry, right? Yeah.
Yes.
Yeah.
That for me, that showed me this was the right subject for me to be doing.
Yes, me too. And I would read articles like if I opened the newspaper and there was an article on, or a magazine, there was something, the magazines, their stuff they had on psychology back in the 80s was not good. But still, I would read every bit of it. Mostly back then it was barely more than kind of astrology, really. But if you feel
Yes.
so very drawn to the magazine articles about are you this sort of person or are you that sort of person, then that's a sign that perhaps you're interested in people and psychology might be for you.
Yeah, love it. Sam, is there anything else you want to add? Anything we haven't talked about
Uh,
that
I
you'd
can't,
like
no,
to
I
share?
don't think so. I don't think so.
Awesome.
But it's been
Oh,
really
well,
fun, and I hope people have found it useful.
oh, I'm sure they have. I'm going to pause the recording now, but yeah, massive thank you.
Okay.